Welcome, everyone, to the final session of the Putting the Pieces Together conference, Mapping the Future of Pain Research. My name is Jenny Lorca. My pronouns are she, they, and sha, and I'm a steering committee member for the Putting the Pieces Together conference, an event by and for people living with pain. My family and I are uninvited guests and settlers of color on the unceded lands of the Coast Salish First Peoples in what is colonially known as the Greater Vancouver Area. We are grateful to the lands and the stewards who took us in, who sheltered us, and who nourished us. I would like to thank the conference's sponsors, Pain BC, the Strategy for Patient-Oriented Research, the Chronic Pain Network, the Canadian Institutes of Health Research's Institute of Musculoskeletal Health and Arthritis, the Partnership for the Engagement of Patients in Pain Research, or the PEPPER Partnership, and Health Canada. Many of our presenters will share stories and perspectives shaped by their individual lived and situated experiences. The views expressed do not necessarily represent the views of Pain Canada or our sponsors. Please remember that these sessions are being recorded and will be available after the conference on Pain Canada's YouTube channel. And again, welcome to Mapping the Future of Pain Research. Please reminded that today's main room session and wrap-up session will be recorded, but not the breakout rooms. We have French interpretation and closed captions available for you. Merci to our translators and interpreters who've been giving you a lot of work to do this week. Also, a gentle reminder that interactive sessions like these can bring up powerful thoughts and feelings related to pain and your lived and situated experience. We ask that you please continue to attend to your needs with care. And also note that crisis resources are available in the exhibit hall under the Pain Canada banner. So if you go onto the Pain Canada banner, just look on the right-hand side and you'll see a download section. So it is my deep pleasure to welcome my friend, Delane Linkowich, who is one of the moderators of this session. Welcome, Delane.
Thank you, Jenny. I'm really happy to be here today. My name's Delane Linkowich, as Jenny mentioned. My pronouns are she, her, and hers. Today I'm joining from Guelph, Ontario, which I wanted to acknowledge is the unceded, stolen land and traditional territories of the Anishinaabe, the Ottawa-Huron, and the Haudenosaunee people, as well as the treaty lands and the territories of the Mississauga of the Credit. I'm really excited to be here today for our last session. I can't believe it's already the last session of PTPT for 2025. And we're really excited about this session. So myself and my friends and colleagues, Alex Haggard and Desmond Williams, will be moderating this with me and facilitating this session with me. So really this idea of this session on mapping the future of pain came together because, we've heard from people who have attended PTPT in the past, and we've had lots of discussions as a conference steering committee about, how pain research really continues to evolve. And we know that oftentimes research questions and, areas of exploration come from kind of that top-down approach where clinicians and researchers are really deciding the topics. And while we know that patient partnership and patient-oriented research is growing, we still know that this isn't happening as often as it should. So therefore, this session today, again, really excited, can't say that enough, is because we've wanted to do something more interactive where we can collaborate as people living with pain and come together and collectively brainstorm high impact research priorities. So, our hope today is that we can come up with these, we can use our own lived experiences and our own expertise from those experiences to really kind of figure out what are some of the priorities that can be researched. And so, our hope is to take the information that we come up with today and share it with the wider pain community and more broadly, but then also with researchers to really kind of ensure that these topics that matter to people who live with pain are recognized and researched. So what we're planning on doing today, like I said, myself, Alex, and Desmond are all going to kind of facilitate different breakout rooms. And so we're going to have a breakout room with each of us in which we will facilitate and walk you through some kind of guiding questions that we've come up with to really hear more about what your kind of research priorities may be. Then what we're going to do is after we go through these guiding questions within the breakout rooms, we're going to kind of do a brief exercise where we're almost going to kind of look at what we have, what we've come up with as a mini individual group, and we're going to kind of rate our top kind of must fund topics. So, some things that we are, after reflecting as a group together, like these are the things that we believe as people living with pain are really important to research. And then what we're going to do is we're going to come back as a big group, and Desmond, Alex, and I are going to share kind of what our individual groups came up with, and then that'll kind of give us a overview of, what maybe some of the shared kind of research priorities or what, each group has kind of come up with to be those most fun or like most important topics. So, that's our kind of plan for today. We're hoping to make this interactive. So when you go out into your breakout rooms, we're going to be using something called Miro board. If you were at the life hack session on Monday, it's kind of similar. Desmond, Alex, and I are going to be kind of leading the Miro board. So don't worry if you don't know what a Miro board is or you don't like technology, we gotcha. We'll do it for you. So what you can do as participants in this is we'd encourage you to engage with us by either raising your hand and then unmuting or popping ideas in the chat. And I just wanted to again really acknowledge what Jenny said that, when we are thinking about things that are important to us that we might want to be researched, this might bring up uncomfortable feelings, understandably from difficult experiences. So if at any point you are feeling overwhelmed or that you need to step away, we really do appreciate that and our understanding of that. And as Jenny mentioned, there's crisis resources that are available in the exhibition area under Pain Canada. On the right-hand side, there's crisis resources. You can click on there if you're in need of them. We hope that this will be, we kind of specifically decided that this is going to be the last session because we really wanted to leave off on a helpful note. A hopeful note and helpful, hopefully, a helpful, hopeful note to kind of see how we can bring forward these ideas and work together to put things that are important to patients into the research space. So with that said, I'm going to invite Carolyn, our wonderful Zoom breakout room wizard, to put folks into breakout rooms. We're going to be in those breakout rooms for about 35 minutes, and then we'll come back and Desmond, Alex, and I will lead that debrief. I don't know about you, Alex and Desmond, but the conversation in our breakout room was pretty awesome, and I'm excited to hear what went on in yours.
Yes, I mean, I feel very affirmed by all the things coming through. It's like those are all the issues that I struggle with as well. And as much as I hate to see that everyone else, across the board, basically is dealing with those same issues, um, it also is, a great way for us to highlight. As we come back together, I'm sure we'll find a lot of crossover on things that people are struggling with. And just for your guys' understanding, I am having just, a little bit more of a flare up of my headache again. So I'm going to be mic off and I'm actually going to turn my camera off for the next moment. But when it is time, I can share my screen and give a little bit of a summary. But thanks.
Sounds good. Thanks, Desmond. Thanks for communicating what you need because that's important too. Um, Alex, how do you want to go first? Do you want me to go first? What are you feeling? Oh, I think you're on mute. Oh, you can't unmute yourself. What if I click the ask to unmute? Does that work?
There we go. Thank you. Yes, I think you know what? I suspect because I joined a little late, I probably got added as a participant. And yeah. But yes, thank you. Happy to go first. And I will be fully honest. We ended up focusing mainly on questions 1 and 2. That's on me. I got too into the discussion and I mismanaged our time a little bit. Didn't leave enough time for the third question. But I think we got some really good discussion around those. And I think can feed into some really good sort of research questions once we take them back and sort of analyze them. And I did, the designer in me automatically likes to group my stickies. So I think we had some really cool, frustrating, but valuable, important themes that emerged. So in terms of talking about like what people are actually experiencing, sort of just lack of access to healthcare at a real baseline is a big one. So everything from wait times and how that is affected in particular circumstances. So if you're living in a small town, um, but also no access to family doctor and how that creates a barrier to accessing specialist care. And so what are the ways that we could potentially sort of facilitate that access so that we don't have primary care where there's such a crisis happening. We don't have them acting as gatekeepers of more specialized care. Um, I would say not directly related, but similar. Also, like, communication coordination between providers, because so much of that work falls on patients, and it's so draining. And we're already dealing with lack of energy. How expensive appropriate and accessible treatments are. The idea that sort of all pain begins with trauma, which may be very true, but like, are we actually giving people tools to cope with it that are effective? Yes, they may be evidence-based, but can they actually be implemented in people's day-to-day lives when they are living with trauma and stress and all of these other structural factors we've been talking about, and low energy and pain? Neurodivergence, and sort of the intersection of neurodivergence and chronic illness, and the way that that creates real barriers to return to work if you've had sort of an employment gap, I thought was really interesting, because that's something I've struggled with a ton. And then quite a few around doctors sort of not being trained for support. They don't believe you, sort of the idea they just throw meds or they just throw CBT at you. Cognitive behavioral therapy. Uh, so, a suggestion here, communication course for doctors, and also just sort of reiterating the not being heard, being misdiagnosed. And then going into some of the more structural factors, I was like actually really happy with what a great conversation we had around these. So we covered everything from stigma and sort of hustle and grind culture, and how pain itself, like the access needs we have as people with pain, are really devalued by society. And sort of similarly, lack of understanding of people with chronic pain and what chronic pain is and how you experience it. Ageism, over-reliance on biomedical model, but also when we try to move away from that, under emphasis on social and structural and systemic factors, and sort of that placement of responsibility back on the individual to manage their own care, manage their own feelings. Medical misogyny, a big, very necessary one. And then another one that I thought was really interesting, because it definitely resonates with my own experience too, is that once you have a particular diagnosis, doctors have a real tendency to slot all of your symptoms under that and then not consider that there may be more going on. So I thought that was a really interesting one. And then finally, some of the questions or maybe initiatives we thought about were, how do we bring our expertise, our lived expertise, to groups to feel heard and promote our own communities? How can we leverage community-based expertise to support others more effectively? And I know Pain BC, there are initiatives around that. So how can we expand that reach? How do we redo all of our baselines to reflect sex differences that we're slowly starting to recognize really affect how quickly people are diagnosed and how they respond to treatments? And sorry, I've taken way too much time, so I will stop talking now.
No worries. I think actually it's helpful because similar things came up in our group as well. Um, I'll go next so we can give Desmond some extra time here. Let me just bring this up. I did not group mine on the go, but you inspired me. So as I was listening, I was, similar things, right? Like lots of like long wait times, the cost of travel, getting to treatment, those types of things. And then just the idea of like after diagnosis or like treatment focus, like we need more workshops, more support group, more education upon diagnosis. We need more coverage for alternative treatments, um, or things like sleep, or social care, you know. Those are the kinds of things that it's almost like kind of like the before or like during like the journey to getting to diagnosis, and then like, or even if you get a diagnosis, because a diagnosis in itself can be difficult to get, and some people never even get a diagnosis, so then, you know, focusing on the treatment side, kind of these sorts of things. And then we also talked about like lack of clinician education about chronic pain, and also their lack of empowerment, and how they kind of don't legitimize our own knowledge and experience. And then this idea of like, I kind of group these together, like whole, like treating the whole person, and also maybe like, is there kind of one specialty or one type of clinician who can kind of have knowledge about lots of different things so that you're not kind of going from one person to the next, and the communication can get broken down there. Other things like working in chronic pain, food, life stressors and inflammatory illness, financial hardships, and then also communication. So communication can also kind of go into this clinician box, but then also the idea of like um, communicating with family and friends and how they don't understand, and empowering our communities with skills and being open to other sources of learning, creating kind of more online hubs for resources, and then like web of care. I'm looking at the time, so lots of the things came up in terms of the reasons that needs aren't being met, similar to what you had mentioned, Alex. And then in terms of our kind of main things that we kind of talked about were more specific communication of education pathways that are accessible and updated, safe and reliable sleep aids for night flares, because obviously we know if you don't get sleep, pain can increase and that can be awful. How can we have more trained doctors available? Because if we have more doctors, then there's going to be less wait times, you know, maybe like even if we have more doctors in different places, then there's less travel needed. Um, just education in general, as well as learning how to be more compassionate for folks who are misunderstood. And that's kind of at the clinician level. And then that brings in the idea of the whole person care, as well as this idea of intergenerational connections in or health professional communities, because we know that there are different types of knowledge and expertise and wisdom that are held. Um, and then regenerative and nervous system repair therapies for chronic pain. And just this idea of like, where are the women? Where are the women in healthcare, in government, and just overall addressing the patriarchy. So those are the main kind of things we talked about. I'll stop sharing and pass it along to you, Desmond.
Thank you. And yeah, I will admit that I haven't really had a chance to, you could say, summarize all of our good contributions. But we were able to, really get a lot of really great suggestions. Oops. There were so many suggestions, so much overlap. When it comes to either lack of family practitioner or not being able to have appointments with specialists, or timely appointments with family physicians, even when I did have a doctor, because my doctor retired out of the blue in April, unless it was like an emergency that had to happen that day, it was around 4 months if I had any issues that like I just wanted to go in for an appointment. And they're like, if you're not dying, see you in 4 months. And it's just so difficult. We've got financial barriers, when it comes to specialty care, physiotherapy, that sort of thing. And there were a number of great suggestions, a number of overlapping things that I see on your guys' board and ours as well. Yeah, and when we look at the reasons, we had a few more summaries. It looked like there on yours, Alex, where it was just maybe just like racism but here we definitely have pretty much those exact things, but just the definitions of them. It really is just that conversation of how many structural things are happening that are affecting our access to care, just in general, affecting our access to care, affecting the healthcare system that is overburdened and underappreciated and underfunded, and yeah, there needs to be more places to go. There's too much admin. The paperwork, the wonderful world of paperwork that we get caught in when we are hoping to either get support or, those of us who have gone through any of the disability paperwork, tax credits, any of that stuff that just, for also in our thing, neurodivergence was mentioned a couple of times. And, for me, anytime I look at a Government of Canada, one of them gc.bc.ca websites, and I see the text, my brain shuts down completely. And is that because I hate the government? No. I think it's more so a conflict with neurodivergence and accessibility to these services and my ability to actually find a way to engage and advocate for myself. And we are coming up on time, so we're just going to summarize Of course, there's always a garbage truck in the alley when my mic is on. Excuse me. Because, yeah, perfect for the migraine as well. But yeah, there are just some really great suggestions here that will be documented. I don't really have a chance to summarize because I don't know if we can summarize. These are all really individual and important issues that we do need to take time to focus on. So with that, I will hand it back to my friends and colleagues, and we'll see if we can dismount clean.
Thanks, Desmond and Alex, first for summarizing. And I think this is such a fun exercise, and I think it really brought up it's really cool to see we were three separate breakout rooms, but a lot of the same ideas were coming up. And I think that is just frustrating and cool. I think, as you mentioned before, Alex, we have 1 minute left, so I'm not going to ramble. Thank you so much, everybody, for coming and for engaging and interacting. We will be summarizing this information and we'll send it out in a similar way as we are going to with the recordings and the life hack session that we did on Monday. Thank you so much. I'm going to pass it along to Jenny to finish up for the day. Thanks so much, everyone.
Thank you, Delane. Thank you, Alex. Thank you, Desmond, for this engaging, affirming, and meaningful interactive session, which is unique to this or any other conference that I've been in. Often I think it feels like we are, as an attendee, it feels like we're recipients of information, but seldom are we active participants. And in this session and in the life hack session on November 3rd, I've really felt a sense of that I was empowered, that I was working towards something collectively. And so I know that we all have extensive networks. So I'm really excited, I think like everyone else here is, to hear about what your plans are for sharing these priorities. Whew. I also want to extend an effusive thank you to all of our presenters and facilitators throughout the entire conference, and to everyone who participated in this session and the other sessions today, and in any of the sessions throughout the week. Resources, as I said earlier, will be available on the conference website for 1 month's time, and you will receive an email when the recorded sessions are available on Pain Canada's website. And as Delane mentioned, the resources that we've compiled today and on Monday will also be made available to you. As we conclude this impactful, deep feelsy, really heart lightening for me week and thoughtful week, it is my honor to introduce our elder, our family, Auntie Patty Williams, to bring us full circle. Auntie Patty needs few words of introduction, even though I have so many. Her presence, kindness, and wisdom speak for itself. So please join me in raising our hands in welcome and in gratitude. Mabuhay, Tita Patty. Maraming salamat po for being with us today.
Yadak Sheik. Good afternoon or good day. Inklakat machine. I'm Inklakatma, Patty Williams and Squashed. My name is Patty Williams. I'm here to do a closing with this protocol I started on Monday at 10, and I'm doing the closing here. We, as an Indigenous elder, we like to bring in these kind of protocols to all these situations. As you can see, I started my smudge already a little earlier. Sometimes it works, sometimes it doesn't. So I thought I'd better get myself together. I guess what I would like to do is just maybe do a little bit of the smudge, and then just because we have like 15 minutes. For me, courage to wash my hands in the sweet smoke so that they may be constructive and reach out to others in a good way. Honesty. I bring the smoke over my head and down my back to lighten my troubles and we bring clarity of purpose. Respect. I smudge my eyes so that I will see good things in people and learn from them. Truth. I smudge my mouth so that I will speak good things to people and learn to choose my words carefully. Wisdom. I smudge my ears so that I will also listen to others, carefully to others, and learn from what they say and become someone they want to talk to. Love. I bring the smoke towards my heart so that what has been damaged can heal, and what pain is to come will help me to stay and strong and grow in a good way. Humility. I wash my feet in the smoke so that I may walk a path full of purpose, compassion, balance, and kindness. May the smoke wash over me and collect my messages of gratitude and gather my worries. Let it all rise up to the sky world. May my ancestors see that I live with a good mind and keep all of my promises. Cooksham, thank you. It's just a nice way of sort of summing up sort of what the conference has been about education, connection. I spent a lot of time this week. I'm grateful that I'm retired and I'm able to spend the time. And so I'm wake up every morning, be grateful to be here, to be on Mother Earth, Father Sky, and be grateful to all the people from the that are on the committee that organized. I know you've been working on this for the whole year. I know Desmond's been busy. He's struggling today, but that's all part of living with our chronic conditions, is accepting where we are in our either health conditions or times in our life. So I'm trying to think what else I can talk about or what I can say. Mainly, okay, so my smudge has already gone out, so I just did it at the right time. Maybe that means that everything's perfect. I wish it was as easy as that. I guess that's one thing I like to bring to the table as an Indigenous elder. So mostly I just feel like an older person, but I'm told that once people treat you like an elder, you're an elder. So I guess I'm an elder now. I'm old enough to be an elder, but I don't know. I still feel like I'm, but it's, I'm in most circles that I'm in, I always talk about kindness, being compassionate for other people around us, for the health practitioners, the doctors, the ones that we get frustrated with, which I know most of them, I'm pretty sure all of them are just as frustrated as all of their patients with the way the medical system is, and they definitely do their best. I mean, but in every profession and anywhere we go, there's people that are well, so many of the medical doctors and people who are in medicine these days are so burnt out. COVID really destroyed a lot of people in the medical field, my daughter included. I mean, she's recovered, but it certainly was something that so as much as I get frustrated too with things that don't get done, I think maybe I'm just I grew up in a time when, little girls would just be quiet in the corner and be pretty and be nice and don't say too much. Well, we started at young, and then I grew up and became a feminist, and that didn't really sit well with some people. And my dad was actually was the one that taught my sister and I to speak up and speak up for ourselves, even though he was a bit, as a father, he was great at that with us. He wanted to make sure that we knew that we had a voice. And so he always brought that to the table and made sure that we were heard and respected, and knew, as an educator, he was a teacher, that he would listen to us, even if he didn't always agree. But I like to also make sure that we have some compassion for the people that we work with, either in our circles or, like I say, in the medical field. Any of the counselors, everybody, we need to have compassion for everyone. I'm the kind of person that will, I like to give people the benefit of the doubt first, but if they mess with me or cross me, then they get a different side of me. But I still choose to be polite. Vocabulary to me is very important. As I say, my dad's a teacher, so my vocabulary has always been fairly extensive, and it seems to run in my family. We love using words for the good and the bad and the ugly, but I think that's kind of, I'm not sure what else, Jenny, you think that I should say. I could do just another little prayer to Creator. On Monday, I talked about Creator as being as each deity that we have in each religion, any of the spiritualities, they're all friends. Like, people need to realize that, I guess that's part of the Indigenous teachings, is no one way of spirituality, way of thinking is better than the other. That's the patriarchy, and it seems to be the colonial way of my way or the highway, or it's that superiority capitalistic decolonizing idea that has made the world not such a happy and safe place for most people. And so for me, the Indigenous spirituality speaks much more to me than any of the other ones that I've looked into. I know a lot of us do different things. For me, it's very holistic and inclusive and not exclusive. Doesn't push people away, doesn't shun. It is an inclusive way of dealing with our lives, our families, things that are going on in the world. And that's how I choose to thank Creator for this day. It's actually here in Coquitlam, the sun came out. It's not raining today. So that means my hands don't hurt as much. So I'm grateful for that, Creator for that. The clouds aren't here. I'm grateful for all the people in these circles that were here today. And I'm grateful for my family and my friends and everything like that. I'm not sure what else I would like to contribute, but I'm grateful to be here as an elder, as a specifically Indigenous elder. I guess I'm a Scottish elder too. Our sides of the family all come from warriors, all people that have the Scottish fighting the British. Everybody's fighting the British, the African, the North American, all the explorers that went around. I'm kind of the ones that are the opposite of the English part, all of my ancestors. So we all come from fighting warrior spirit type people, and it's, which I'm proud of. and glad to, and most of us are. That's why we're still here. All our matriarchs and patriarchs survived all the different atrocities and different things in all our different cultures. Oh, I know what I wanted to say. I was thinking about that this morning. Culture saves lives. And a lot of people in downtown East Side, a lot of places around here. And it's just Indigenous cultures. I'm talking about everybody's cultures, whatever culture your family is from. I used to talk about that a lot in the schools where I worked, everywhere I go, whatever your ancestry is, your family, their culture, maybe it's the arts, maybe it's the music, maybe it's whatever. Those are the kinds of things. Culture saves lives. Musical theater, Desmond. Art, my cousins that are artists. Me, I'm a cedar weaver. I do cedar weaving. Find your thing. It doesn't have to be painting and drawing or artistic. There's so many ways of sharing and and understanding other people's culture too. Every culture saves lives, gives us connection, and gives us power over things that are going on. That's why I like cedar, because I can make it. I used to laugh at when I worked in high school. Can't make teenagers do anything, but I can make beads go where I want them. I can make my cedar work. I can manipulate it, and it just has to do what I say, the way I work it. And so that doesn't really happen with people. But so that's why sometimes art is a way of keeping control and having that satisfaction of things going your way. So Kuksham, thank you. And how are we doing for time, Jenny?
You're absolutely perfect. If this feels complete to you, you can pass this back to me, Auntie Patty.
Okay, thank you.
Yeah.
Kuksham, I'm really grateful. I'm grateful to be here today, and a little humbled for being in these settings. Kuksham, thank you.
Thank you, Auntie Patty. What an immense joy and comfort it has been to have you with us for this entire conference, and not just this conference, knowing that you've been like having our backs the last 4 years of this conference existence. So and thank you for ending us as we began this year with kindness, compassion, gratitude, and more importantly, what I think Cornell West has described of justice, which is love in public. So my heart is full and my spirit is light. Maraming salamat po. Thank you. Yes, culture saves lives. Yes, yes, yes. So I have a few words before we sign off for another year. In honor of Indigenous Veterans Day tomorrow, November 8th, and of Remembrance Day next week, and of those past and present who have served our country, I would like to acknowledge that veterans are still a large and underserved population who live with chronic pain. I saw a really lovely comment in the chat just now, or before Auntie Patty, who spoke about connection and connectedness and their gratitude about it. And thank you for acknowledging that. This is what we hope to do every time we show up. And we're grateful that you show up for us every time too. I hope that this conference invites you into this conversation about pain, because as we have seen throughout this entire week, pain isn't just an individual experience, it's a community experience, it's a collective experience. And it's through the shared efforts of our dynamic and collective voices that we can indeed effect change, like possibly today, right? So that no one has to live alone with pain. I'm just channeling Desmond to take a breath. And on that note, have a great afternoon, everyone. I'm wishing you lots of comfort and ease. And as Vina Mohabir said in our session with Emerald Asuncion and Mehmuna Musamita, go rest and take extraordinarily good care. Thank you.